Emotional well-being is just as important to us as breathing is. Hi, I am Kobe Aninyan and I will be your guide in our discussion about clientele and audiences in counseling. Clientele and audiences in counseling. The clients and audiences of counseling profession come from different settings. Counselors deal with a mixture of people with different concerns and issues. Through the years, special counseling population has evolved. The special clientele has been giving increasing attention by the counseling profession due to frequent occurrence and the growing number of clients. The special counseling population is composed of people who abuse drugs, people who use tobacco, women, older adults, people with AIDS, victims of abuse, gay men and lesbian, and people with disabilities. So for today's video, me and my group will be talking about them.
People who abuse drugs. In our society, there are increasing drug users. Drug abuse is not just harmful to our physical health, but to our mental health as well. It cannot be denied that drug addiction creates more special problems and contribute to social disintegration. Consequently, more youth victims cry for help and seek for counselors' attention.
People who use tobacco. Slowly, our population recognizes the bad effect of tobacco to our health. However, many people still use and continue to use tobacco even if it is deadly. Users find it difficult to stop smoking. Hence, smokers who desire to quit tobacco were added to the list of counselor audience.
People who abuse alcohol. Alcoholism is seen as a disease and alcoholics find it difficult to stop drinking on their own. This requires help to professionals as it requires appropriate treatment. However, an equally important paradigm is to look at alcoholism as a sickness of self-control and self-discipline. Therefore, this requires intervention other than treatment.
The woman. Even the changing role of women in society, men still predominantly control purchasing and decision-making powers. Most men still have less participation in household responsibilities and childcare. In this case, women's advancement is constrained. What complicates the situation is the woman's perception about themselves and the society's expectation. Counselors are responsible in helping women appreciate their own values, abilities, aptitude, and interest, and to utilize this to develop their full potential.
Older adults. The aging population is increasingly and demands more attention. Retirees who are adjusting to life outside work fellows and ignored. Life for them suddenly loses meaning. A transition from a busy life of retirement stage must be instituted. This challenge to the counseling profession. Other aging issues that require attention of counseling include loss of partner, decline to mental capacity and mobility, increased loneliness.
People with AIDS. Acquired immune deficiency syndrome has been labeled as the most feared disease due to its curability. Victims of this disease are seeking help to improve their quality of life to handle their emotional stress and low self-esteem. Counseling approach requires sensitive and appreciation of the intricate of the disease. Counselors may also help in assisting and educating the victim's support system.
gay men, and lesbian women. There are a growing number of gays and lesbians that are coming out. However, there are still sectors in the society, including their own families, that avoid and discriminate them. They are usually the victims of harassment, violence, discrimination, and isolation.
Thank you for watching our video. We hope that you learned about clientele and audiences in counseling and the special counseling population. Once again, this is Colby Aninyon signing off.